Oklahoma's healthcare system has plenty on its plate right now. They're ramping up the testing, conducting research to find a cure for COVID-19, and working to ensure our hospitals are capable of handling a surge in patients. ONR's Jason Doyle hosted a panel discussion with leaders in the field to discuss those topics and more at our OETA studios.
And joining us on the roundtable today is Dr. Dale Bratzler with OU Medicine and Dr. Eliza Chakravarty with the Oklahoma Medical Research Foundation. Thank you so much for joining us here. Let's talk a little bit about COVID-19 and all the things that Oklahomans need to know. First of all, I'd like to start with you, Dr. Bratzler. When it comes to testing, it's a big topic. People have a lot of questions. What should Oklahomans know right now in this situation?
So I think it's really important that everybody understands that when we first started seeing cases in Oklahoma, testing was largely limited to that which could be done through the Oklahoma State Health Department, and they were getting their test kits from the Centers for Disease Control, and there was a real restriction on the number of test kits available, so we did very little testing. That supply now has improved. Also, you may have seen that the Oklahoma State Health Department signed a contract with Diagnostic Laboratories of Oklahoma, a commercial laboratory, and that's increased their capacity to do testing. And through virtually every major hospital system, including OU Medicine, we now have contracts with a variety of different commercial laboratories to increase the number of tests that are available. And we also are working really hard to develop in-house capability to do the test ourselves so we don't have to send them outside and can increase the speed of turnaround for the results.
Dr. Chakravarty, when it comes to a medication that has been touted by the president, you actually work with that medication. Tell me a little bit about it and what it really treats right now outside of COVID-19.
Sure. So the medicines that have been talked about a lot are hydroxychloroquine and chloroquine. And those are both antimalarials that have been around for decades. But we have learned, and we use it to treat diseases like lupus, systemic lupus erythematosus, and rheumatoid arthritis. And these are very specific autoimmune diseases. And these medicines have been shown to be very helpful in those diseases. And what we're worried about right now and what we're doing on the front lines right now is trying everything we can to make sure that our patients who need these drugs for their very specific diseases have access to the drugs.
So how does this fit in with COVID-19?
Well, there have been some anecdotal reports that these drugs may help resolve or clear the virus faster in hospitalized patients who have COVID-19. But again, these are very anecdotal reports. They're not randomized controlled trials, so we really don't know whether or not they're effective or in whom or what stage of the disease they're effective. And so our big worry is that hearing this anecdotal evidence, people are very interested in obtaining the drug for treatment of all stages of COVID-19 or even to prevent COVID-19. And that's really leading to a shortage of the drug for our patients who need it. And what we worry about is if our patients with lupus and rheumatoid arthritis aren't able to get their medications or able to get the hydroxychloroquine for their disease, that they may have disease flares, which will put them again at higher risk. They might need to be treated with steroids, which is a very immunocompromising medication, which could lead them at higher risk to get the disease and to have complications should they develop or should they become infected with COVID-19.
Wow, very, very interesting. Dr. Bratzler, OU Medicine is getting very, very involved with the effort here in Oklahoma. What kind of things is OU doing right now?
So we're obviously doing a lot of preparedness. Because we expect the number of cases in Oklahoma is going to continue to rise, and so we want to make sure that we have enough hospital beds, ICU beds, and ventilators should we need them for patients that come into the hospital. To Dr. Chakravarty's point about the drugs, we're actually participating in some of the clinical trials that are helping us to determine whether there is a role for some of these medications to treat patients or not. Right now there's very limited evidence and these drugs do have side effects, so we're being very, very cautious about recommending them for anybody, but using them in clinical trials when patients are actually hospitalized.
And Dr. OMRF is also involved with some of the research.
Yes, so we are, some of the basic scientists at OMRF are working with OU to develop in-house COVID-19 testing. So just like we were talking about, so we can have the turnaround, access to testing and turnaround be much more rapidly. On the clinical side, we're working with our patients who are high risk because they're immunocompromised to keep their diseases under control, keep them out of the hospital related to disease, and to prevent them from getting infected as much as possible.
When it comes to hospital capacity, we're hearing a lot about that and preparing, as you said a little bit earlier, Dr. Bratzler. What's the status of our hospitals here in Oklahoma? I know we keep on talking about bending the curve. Where are we at right now?
Yeah, so two different concepts. So one is hospital capacity. Right now, I think all of the systems in the state now, the governor has given an executive order that have asked us to stop all elective procedures and operations. So we've stopped all of that. We're reducing the number of patients that come into our clinics to those that really need to be there. And what we've seen is that has substantially increased our capacity right now for taking care of patients should we see a surge in the number of patients with COVID-19. And we are starting to see more admissions in patients who test positive for COVID-19. With respect to bending the curve, the big thing, the most effective intervention is social distancing, isolation, to increase the number of days between when the number of cases of COVID-19 in Oklahoma actually double. Right now we're still seeing exponential growth in the number of cases, meaning that the number of days between doubling of cases is very, very short, 2 to 3 days. But what we hope to do very quickly is with all the social distancing that we're doing, can start spreading out. I always say increase the days. That the number of cases double, which will bend the curve and actually reduce the number of patients who might be ill at any single point in time, so we have the capacity to take care of those patients in the hospitals. And
we've just got about a minute left, and I'll field this to both of you. About how long can we expect until we can come up with a vaccine that might be able to prevent COVID infections?
My answer has always been, I think, expect it to be at least a year and maybe longer, because they're really just now starting some phase 1 clinical trials of the new vaccines that are being developed.
I would say the same thing. I would expect a year to 18 months at the minimum, because all of the rigor that needs to go into making sure that the vaccines are safe and effective.
Doctors, I really appreciate you joining us for the roundtable here for the Oklahoma News Report.
Thank you.
Thank you.